Ever wondered how crucial is pain assessment in medical practice? Well, let's delve into it. Pain assessment is like the compass of a clinical examination. It doesn't just help in diagnosing a patient's condition, it also plays an important role in evaluating the effectiveness of treatments. Think about it. Without assessing pain, how would we know if a given treatment is alleviating a patient's discomfort or not? Moreover, pain assessment is vital in improving patient outcomes. It's not just about asking, does it hurt? It's about understanding the nature of the pain, its duration and its intensity. It's about navigating through the layers of a patient's experience to truly comprehend their discomfort. So you see, pain assessment is not just a step in the process, it's a critical component of effective healthcare. The key to effective pain assessment? The SOCRATES mnemonic, but what does it entail? Stay tuned to find out. Delving into SOCRATES, each letter stands for a specific question related to the patient's pain. Let's start our deep dive with the first letter, S, which stands for sight. This question seeks to identify the exact location of the pain. Is it in the chest, the stomach, or maybe the lower back? Determining the site of the pain is the first crucial step in the pain assessment process. Next, we have O for onset. This is where we want to know when the pain began. Did it start just a few hours ago, or has it been a lingering issue for days or weeks? And importantly, was the onset sudden or gradual? Understanding the onset can provide valuable clues about the possible causes of the pain. The third letter, C, represents character here. We're trying to get a description of what the pain feels like. Is it sharp, dull, burning, or throbbing? The character of the pain is a window into the type of tissue that may be involved. The R in SOCRATES stands for radiation. This seeks to find out if the pain moves or radiates to any other parts of the body. For instance, chest pain that radiates to the left arm could suggest a heart condition. Next, we have A for associations. This asks if there are any other signs or symptoms that come along with the pain. Nausea, dizziness, shortness of breath. These associated symptoms can be crucial in painting the full clinical picture. T for time course queries whether the pain follows any pattern. Is it constant, intermittent, or does it follow a particular pattern? Time course can help differentiate between different conditions. The penultimate letter, E, stands for exacerbating or relieving factors. This question investigates if anything makes the pain worse or better. Does rest alleviate the pain, or perhaps certain movements provoke it? This can guide towards the right management approach. Finally, we have S for severity. Here we ask the patient to rate their pain on a scale of 0 to 10. This helps quantify the pain, providing a baseline to assess the effectiveness of interventions. It's not just about asking these questions, but understanding the answers. Each piece of information brings us one step closer to diagnosing and managing the patient's pain effectively. So why SOCRATES, and how do you apply it in pain assessment? The beauty of SOCRATES is in its comprehensiveness. It's not just about identifying the existence of pain, but understanding the story behind it. You see, pain isn't merely a sensation, it's a complex experience, interwoven with physical, psychological, and social aspects. SOCRATES equips healthcare providers with a structured framework to uncover this story, which is critical in formulating a diagnosis and planning treatment. Imagine you're a detective. The patient's pain is the mystery you're trying to solve. SOCRATES is your investigative tool, guiding you through a systematic yet empathetic interrogation of the pain. Each letter represents a key question about the pain: site, onset, character, radiation, associations, time course, exacerbating, relieving factors, and severity. When you delve into these aspects, you're not just ticking off a checklist, you're piecing together a complex puzzle that unravels the nature and underlying cause of the pain. The beauty of SOCRATES doesn't stop at diagnosis. It plays a pivotal role in monitoring treatment progress and adjusting the care plan if necessary. For instance, a change in the character or severity of pain could indicate a response to treatment, or perhaps the development of a new problem. It's like having an ongoing conversation with the patient's pain, keeping you attuned to their evolving needs. The practical application of SOCRATES isn't confined to a specific clinical setting. Whether you're in a bustling emergency department dealing with acute pain or a quiet clinic managing chronic pain, SOCRATES is your trusty ally. It transcends the barriers of specialties, applicable to a broad spectrum of conditions, from a simple muscle strain to complex cancer pain. In essence, Socrates transforms the pain assessment from a mundane routine to a meaningful dialogue. It fosters a deep understanding of the patient's pain, enabling healthcare providers to deliver personalized, effective care. Pain assessment is more than just a routine check. With Socrates, it's a detailed, empathetic conversation with the patient to understand their pain and provide the best possible care.